Hello, welcome to today's session with Calebmulonga on nursing insights with Calebmulonga. So, in the previous videos, we have looked at the pathophysiologies of hypertension, CCF, and renal failure. And it was only right that we look at the classes of drugs. So, in our video today, we're going to look at the antihypertensive drugs. And we've only chosen 6 of the main classes that we use in the hospital setup, especially here in Zambia. So we have the beta blockers, angiotensin converting enzyme inhibitors, angiotensin 2 receptor antagonistics, calcium channel blockers, vasodilators, and diuretics. So we have 6 that we're going to look at in this video, and each group we're going to explain the side effects, mode of action, and the most common drugs that are used. So stay tuned as we continue with our lesson. Our first drug is the beta blockers. Our first class of drugs is the beta blockers, also known as beta androstenedione antagonistics. So these are drugs that are used in hypertension, like I earlier said. So the mode of action or the mechanism of action, they block the action of the sympathetic nervous system on the heart, therefore relieve stress on the heart. So these beta blockers block the action of the sympathetic nervous system and therefore relieve the stress on the heart. So in our previous videos, we spoke of the sympathetic nervous system and the effect that it has on the heart, where it increases the heart rate and increases vasoconstriction and the contractility of the heart. So these drugs block the action of the sympathetic nervous system, therefore relieving the stress on the heart. They slow the heartbeat, lessen the force with which the heart muscles contract, and reduce vasoconstriction in the heart, brain, and throughout the body. So the easiest mechanism of action here is the beta blockers block the action of the sympathetic nervous system on the heart, therefore relieving stress on the heart. Or you can say they slow down the heart rate, lessen the heart muscle contraction, and reduce vasoconstriction. So you can use any of those two, but here we've put them there so that we can understand the drug better. So here we have one of the most common drugs. In fact, here we are going to look at 2. So the first one of the 2 most common drugs under the beta blockers is atenolol. So atenolol is the one that is mostly used in Zambia. So presentation, it is usually tablets containing 25 milligrams, 50 milligrams, and 1000 milligrams. Then there's also injectable 500 microgram per ml. Indication, it is usually used in hypertension, angina, and arrhythmia. The dosage is 50 to 100 milligrams OD or BD. Side effects, there's bradycardia, fatigue, insomnia, and sexual dysfunction. So in this class of drugs, we've seen that there is slowing down of the heart. So one of the side effects here surely will be bradycardia, because the heart rate will reduce below its normal if as a side effect of the drug. Then fatigue because of vasodilation, which we've spoken about, the reduction in vasoconstriction, and also reducing of the heart rate that can lead to fatigue. So those are two side effects that are easily explanatory. And then we also have nursing implications. Under nursing implications, we have to monitor blood pressure and pulse. As we have seen, the mechanism of action is that it slows the heart rate. And then monitor the patient for any side effects. So that's about atenelo. We move to the next one, which is propranolol. So this is also common in Zambia. And the presentation tablet, and it's usually in 10 milligrams, 40 milligrams, and 80 milligrams. So mostly the dosage is 40 milligrams OD. Side effects, we have bronchospasms, bradycardia, nightmare, insomnia, and posterior hypotension. So here you find that these side effects, the way you can easily trace them is, easily identify them is by looking at the mechanism of action. So we've spoken about where bradycardia is coming from. We've also spoken about bronchospasms are coming as a result of blockage of the sympathetic nervous system. And the posterior hypotension is coming as a result of the reduced blood pressure that will result as a consequence of the drug. So the blood pressure will reduce, and when it reduces to a certain level, there will be posterior hypotension. This is the hypotension that occurs when someone stands. When you are seated, then you stand. That's the hypotension. So that is posterior hypotension. And then nursing implication for both genders. Agents, meaning the propranolol and the atenolol. So we assess the manifestation of heart failure, check the pulse rate regularly, and do not withdraw the drug abruptly, suddenly, in patients with heart diseases. So that is about the drug propranolol and the beta blockers. So we move to the next class of drugs. And this one is angiotensin converting enzyme inhibitor. Angiotensin converting enzyme inhibitors. So the most common drugs here we have enarapil and captopril. So here, just the name itself will tell you angiotensin converting enzyme inhibitor. So it inhibits the enzyme that facilitates the conversion of angiotensin 1 to angiotensin 2. So that is a mechanism of action. It prevents conversion of angiotensin 1 to angiotensin 2, thereby preventing the vasoconstriction associated with angiotensin 2. So that's just a simple mechanism of action. It prevents the conversion of angiotensin 1 to angiotensin 2, thereby preventing vasoconstriction associated with angiotensin 2. So the drug that we will use under this class is enarapil. Presentation: 10 milligram tablets, dosage 10 to 20 milligrams per day. it is usually OD or BD. And then side effects, we have hypotension, cough, dry. The cough is usually dry and persistent. So here, hypotension will result due to the reduction in the blood pressure. And the nursing implications should be the drug should be avoided or should be restricted in renovascular disease and in pregnancy. So a narrow pill should not be given in pregnancy and should not be given in patients with renovascular conditions, meaning patients who have renal conditions, to be general. So that is about enarapil, and it was the only drug that we used under the angiotensin converting enzyme inhibitor. So that's the second one. The third class that we're going to look at is the angiotensin 2 receptor antagonistic. So here we have quite a number of drugs that are common, but the most common drug that we have is losartan and valsartan. These are the two most common drugs that we have in Zambia. So mechanism of action. So you can tell from the title that it's about blocking the angiotensin 2 receptors. So it blocks the receptors of angiotensin, resulting in vasodilatation. We said angiotensin 2 is a vasoconstrictor, so it causes vasoconstriction. So by blocking its receptors, that will result in blocking its action, and that will lead to vasodilation instead of vasoconstriction. The most common side effects, we have hyperkalemia and acute renal failure. So due to vasodilation, you find that there will be less, the blood vessels will dilate, and there will be hypotension might occur because of the dilatation, hyperkalemia due to electrolyte imbalance, and renal failure due to hypoperfusion of these of the renal system of the kidney. And the most common drug that we have here is losartan, which is 50 to 100 milligrams per day, and it is usually OD or BD. So here, this is the only thing that we have. And this drug should not be given in patients with renal conditions because of its side effects. So from that class, we move to our fourth class, which is calcium channel blockers. So the calcium channel blockers, the most common drugs that we have nifedipine and amlodipine. So nifedipine is the most common drug in Zambia in this class. So mechanism of action. These agents effectively reduce the blood pressure by relaxing the muscles of the blood vessels and slowing the heart rate, thereby reducing the force of the cardiac contractions. So mechanism of action of this drug, this class of drugs, is that it reduces blood pressure by relaxing the blood vessels, the muscles of the blood vessels, which will cause vasodilation, and slowing the heart rate. So by slowing the heart rate, it means the heart rate will be low and there will be reduced on normal cardiac output and reduced stress on the heart. And then by relaxing blood vessels, there will be vasodilation instead of vasoconstriction. So it relaxes the blood vessels, the muscles of the blood vessels, and slows the heart rate. I hope that one's clear. And then the common drug here is nifedipine. Presentation, tablet or capsule. So mostly it's tablet in Zambia. We have 5 milligrams, 10 milligrams, and 30 milligrams. The dosage, we have 10 milligrams sublingual or oral, and it's OD. So mostly you either give sublingual, especially if it's a start dose, and oral if it is a continuous dose OD. Side effects include dizziness, fatigue, nausea, headache, and edema. So remember here, the reason why we have fatigue, dizziness is because of the vasodilatation that is occurring, the slowing of the heart, and these are the things that are causing this dizziness and fatigue, and headache can occur due to the same. So in almost all the hypertensive drugs, one of the side effects is fatigue, and the other one is hypotension in almost all of them. So in case you get stuck, you just remember that hypotension and fatigue are mostly common in almost all the classes of antihypertensive drugs. The nursing implications: watch out for edema, advice on rest, and give attractive food. So because of nausea, you give attractive food, and you also watch out for edema and advise the patient to rest. So we go to our fifth class, which is vasodilators. We have hydralazine and methyldopa. So hydralazine is the most common drug in our facilities in Zambia, but methyldopa is also available, but it's not just mostly used. So mechanism of action, it decreases peripheral resistance, but concurrently elevates cardiac output. So it acts directly on the smooth muscles of the blood vessels, causing them to dilate and therefore reduce blood pressure. So in vasodilators, they cause the smooth they directly affect the smooth muscles of the blood vessels, causing them to dilate and reduce the blood pressure. So that's the mechanism of action, just like the class, the name of the class itself, it causes the blood vessels to dilate. Methyldopa is effective in the treatment of hypertension in pregnancy. So in pregnancy, we can also use methyldopa under this class of drugs. So hydralazine, presentation tablet, which is 25 milligrams, 50 milligrams, and we also have 20 milligrams per meal. Dosage is usually 20 to 50 milligrams BD. Side effects include headache, flashing headaches, have dizziness, increase heart rate and cardiac output. So here we also have hypotension as a side effect. So here, remember, our blood vessels are dilating, causing a rapid decrease in blood pressure. So that's why we have dizziness and we also have headaches. And the increased heart rate and cardiac output is to facilitate the dilation of the blood vessels. The nursing implications, we have to watch out for hypotension. So if we've noticed, or if we've not been in a clinical setup, hydralazine is a very dangerous drug, and it is not usually just given because it is a rapid acting vasodilator, meaning when it is injected, the person's blood pressure will reduce in 5 minutes. So if it is given and you don't watch for hypotension, the person can easily die from hypotension if it is not properly administered or properly monitored after the administration, especially the IV hydralazine. Then we also give attention to fluid retention so that we can observe if we have any edema and all these other side effects. So that's about hydralazine and the vasodilators. Our last class is the diuretics. So we have different classes under the diuretics, but here we're only going to look at the loop diuretics. We're going to make a separate video later on the diuretics, stressing the importance of the drugs, the different classes they're in. But here we're only going to look at the loop diuretics, to be specific, furosemide, because it is the one that is mostly used in the clinical setup. So the mechanism of action: to reduce sodium chloride reabsorption in the ascending loop of Henry, to prevent fluid retention and reduce circulating blood volume. So the loop diuretics, to be specific, furosemide, it reduces sodium retention, and then it prevents fluid retention and reduces the circulating blood volume by increasing urine output. So here, these diuretics reduce water and sodium retention in the kidney and increase urine output, therefore reducing the circulating blood volume or the fluid volume in the body. So the drug of choice here, the most common drug is furosemide, which is also called Lasix. So presentation, 20 to 80 milligrams once oral or intramuscular IM. Side effects include polyuria, hypokalemia, blood volume depletion, dehydration, constipation, hypocalcemia, hypomagnesia, and hyperglycemia. So here you find that polyuria is common because there is increased removal of fluids through urine. Hyperkalemia and all these elements, there is electrolyte imbalance because of the increased urine output. Then there will be dehydration because this person is urinating a lot. And then constipation and blood volume depletion, all these are as a result of increased loss of fluids. Then the nursing implication: schedule doses to avoid sleep disturbances. So here you find that if you give this drug in the night, this person will be constantly urinating. Therefore, that will disturb the sleep. The person has to go and urinate. Then observe patients are having IM or IV and monitor vital signs. So you have to monitor for vital signs. We have to daily weighing of the patient, Monitor strict intake and output. So here, this is to avoid dehydration. Advise patient to take a lot of bananas to prevent potassium depletion. So this is as a result of the electrolyte imbalance. Advise patient to take a lot of oral fluids to avoid dehydration. If the patient is dehydrated, we can commence IV fluids. Then contraindications, it is contraindicated in nephrotic syndrome and hepatic coma because of its side effects. Because here there will be increased loss of fluids and all this, and the mechanism of this drug is mostly affecting the kidneys. So we have looked at the six most common classes of hypertensive drugs, and we have explained the mechanism of action and the common drugs that are found in each class. So we have come to the end of our lesson. Thank you for being with us. Watch out for the next video that we are going to put out in the coming days. So please subscribe to our YouTube channel at calebmulonga. Like, comment so that we can interact and share our videos to other people. And for those who are interested in the tuitions that we offer, you can contact me on Facebook at calebmulonga so that we can schedule meetings for tuitions. Thank you. See you next time.